right, let the record reflect the state's president, defense counsel, the defendant are all present. We ready to proceed?
Yes, Your Honor.
Defense ready to proceed?
Yes, Your Honor.
Okay. Over the lunch break, now you said you have one more witness. Is that correct? Ms. Shirley, sorry. You have one more witness?
I do.
Okay. And have you had an opportunity to discuss with Mr. Wilson whether he wants to testify or not in this case?
I have.
All right. And Mr. Wilson, you've had an opportunity to talk to your attorneys about whether you want to testify or not testify. Is that correct?
Yeah.
Okay. And have you made a decision as whether you want to testify or not?
Yeah.
And what is that decision?
I don't know.
Okay, very well. Is anybody forcing you not to testify?
No.
Okay. You're making that decision of your own free will? Okay, very well.
The only other thing I'd want to mention to the court is we had some photographs that we had intended to have Mr. Wilson identify. The state was kind enough to stipulate those into evidence. However, in discussing that with Mr. Wilson, because they depict other family members that he doesn't want brought into this, I have left them with the clerk as our Exhibit B, and we're not going to be seeking introduction.
Okay.
I want the clerk to go ahead and maintain those anyways. I don't want them back because it still might be part of proceeding in the future.
Okay. All right.
It's just going to be an exhibit that's not admitted.
So it's Defense Exhibit
B.
B. Okay. They'll be marked as such and submitted to the clerk
Yes,
as marked exhibits, but not admitted at this
Yes,
point.
sir.
And that's of your own decision because Mr. Wilson doesn't want them admitted with the other family members depicted in them?
Yes, sir.
Okay, very well.
I would just ask that Mr. Wilson
Yeah.
on the record agrees.
That's fine. Mr. Wilson, you're in agreement with
Yeah.
that?
Yes.
Okay, very well.
The one other thing, I don't think we actually addressed is addressing confessions and various things throughout the course of this trial. During the defense's opening, they did concede to two of the state's aggravators. I just want to make sure that Mr. Wilson was in agreement with that.
That's fine.
strategy as well.
That's fine. Mr. Wilson, you heard the opening statement by defense counsel. You were in agreement with that, sir?
Yeah.
Okay.
Well, just so we can be specific, you understand the aggravators they're talking about, that you were on probation at the time the event occurred? Yes. And the fact that there were two simultaneous deaths? Yes. Or contemporaneous?
Okay.
That's fine.
Very well. Anything else?
No.
All right. And I saw you did get a revised version of the final instructions emailed out. Have you had a chance to look at those yet?
I did.
Okay. Any objection to those
No,
at this
sir.
point? Okay, we'll go through a formal charge conference after we're done, but then, all right. Let's bring in the jury then.
Just out of curiosity.
Yes, sir.
Is it the court's intention to try and resolve this case in its entirety today?
I'm going by what you all have left to present, and so it kind of depends on where we are. I don't know how much longer you all have in terms of your presentations or closing arguments, so I guess we'll see.
It's just, my only concern is that one of your brethren kept us in the courtroom until 11:30 one night because he didn't want to sequester the jury, which I certainly understand. I'm just not sure at what point in time we would have to sequester the jury.
Okay.
Obviously,
I do thank you for bringing that up.
if we had done closings and instructions, you're going to have to sequester them, or you're going to have to let them go however long they're going to go.
Now, at the beginning of the trial, I did inquire whether you wanted to have the jurors sequestered or if you wanted to waive sequestration. We can have that conversation again, but by implication, are you indicating you would want them sequestered or would you waive sequestration?
Well, let's wait till the time comes so I have an opportunity to talk to Mr. Wilson.
Very well.
It's his trial, so.
I understand. State, any input on that?
Not at this point.
Okay. Well, we'll cross that bridge when we come to it if
Yes,
we come to that, okay? All right. Ready to bring the jurors in then?
Yes.
All right.
We'd call on Dr. Mark Mills.
Okay. All right. Dr. Mills, if you'll face the clerk, raise your right hand.
Do you solemnly swear or affirm that the testimony you give will be the truth, the whole truth, and nothing but the truth?
I do.
You may take the stand.
Just want your stuff. Good afternoon.
Good afternoon, Mr. Shirley.
Would you please tell the jury your name?
Yes, it's Mark Mills, M-I-L-L-S.
And what is your profession, sir?
I'm a psychiatrist and forensic psychiatrist.
Okay. What is a psychiatrist?
It's the kind of physician that studies disorders of the mind, disorders of behavior, disorders of affect or emotional state, and disorders of thinking.
What's a forensic psychiatrist?
The person who uses that knowledge in courtroom proceedings such as this, criminal trials where issues of intent or illness may be relevant, and in civil trials where issues of injury or mental state may be relevant.
Do you have a doctorate?
I have a MD, yes, sir.
Okay. And so obviously you have schooling. Would you give us a brief synopsis of your schooling?
Sure, briefly. Attended and graduated University of California, Berkeley, 1967. Then attended and graduated Harvard Law School, 1970. Returned to Berkeley for pre-medical education and attended Stanford University School of Medicine, 1971 to 1975.
And what year did you receive your MD?
1975.
And was that in California?
Yes.
And is that degree good here in the state of Florida?
With a medical degree, I mean, my graduate degree is good. You have to get licensed someplace. I've been licensed in California, Massachusetts, Washington, D.C., Maryland, and in Nevada, and I maintain my Nevada license.
Florida also?
No, not in Florida.
Okay. What do you have to do to practice here in Florida?
Well, I mean, pretty much you have to do the same thing you practice anywhere in psychiatry. You have to have a medical degree, have to have completed an accredited residency, have to take in the relevant examinations, and in my case, I'm board certified both in psychiatry and in forensic psychiatry, so I took those examinations as well.
Okay. Have you been tendered as an expert in the court of law anywhere in the United States?
Literally hundreds of times in many states and in many federal jurisdictions.
Does that include Florida?
It does.
And what kind of matters do you testify to?
Well, issues of competence to stand trial, criminal responsibility, sanity or insanity, fitness to be executed, a variety of issues like that, generally, of course, involving serious mental states.
In this particular case, you were appointed by the court in order to assist Mr. Wilson's defense team, is that correct?
Yes.
And were you assigned the task of determining whether or not Mr. Wilson had any mental health disorders?
That's correct. That was the task that you and your colleague, Mr. Hollander, asked me to consider.
Okay. What did you do in order to be able to render an opinion if you have one?
I have one, and the answer is I attempted to interview him on 3 occasions. One of those was moderately successful, and 2 of those were largely unsuccessful. I reviewed the records. You heard Dr. Eisenstein describe the records that he reviewed, and I reviewed essentially the same group of records. I also interviewed perhaps a few more witness statements. I interviewed the jail medical records, which are 500-600 pages at least, although in general they're not particularly productive. I spoke to the adoptive parents, mother and father, and to the elder adopted sister, the radiologist of whom we've heard some testimony.
Okay. In addition to speaking with the radiologist, did she provide, or did we provide you with a letter that was authored by her?
Yes, you did.
Okay. And did you take that into consideration in determining your diagnosis?
I did, because it was both, I thought, perceptive and useful in describing her adopted brother's background.
May I approach the witness, please?
You may.
Dr. Mills, let me show you what's been marked. Mr. Wilson's Exhibit A.
Yes, sir.
I think it's already been identified by your predecessor on the bench or on the stand, but can you tell me, is that the letter that I've referenced?
It is.
Okay. And you read that in its entirety?
I did. Although it's not trivial, it's not particularly long.
All right, and that was a significant part of your consideration for his diagnosis?
Yes, sir.
May I approach?
You may.
We'd like this admitted as our Exhibit A, Judge.
Any objections?
Yeah, no objection.
Admitted.
Judge, I wanted to publish that for the jury, but it's not going to work on that device. I have 14 copies that I can let them all read at the same time, so we don't waste any time, and then we'll just gather the copies back.
Okay. Any objection? Okay.
And I'll apologize to the jury in advance for the small font. It appears they're all done, Judge.
All right. Have all the jurors had an opportunity to view the exhibit? All right, you can hand it back to the bailiff. And for the record, all the jurors nodded in assent that they had been able to look at the exhibit.
Yes, sir. Thank you. All right, Dr. Mills. One thing you just said, you looked at hundreds of pages of medical records, jail records, but they weren't particularly useful. What did you mean by that?
Well, as you know, all kinds of individuals write in jail records, reflecting all kinds of level of training and sophistication and skill. Additionally, jails are primarily designed to contain and control, so it isn't that they are oblivious or uncaring about mental issues, but they, as a group, those who write in jail records are not particularly skilled or interested in those issues unless they're causing significant behavioral disruption. So very often one can wade through hundreds of pages of jail records and not learn very much.
Okay. Were there things in the notations in the jail record that you found were of value to you?
Sure. I mean, first of all, as Dr. Eisenstein indicated, there are a number of diagnoses that are in the jail records, and that reflects at least the suggestion, if not more, of some kind of significant psychiatric or mental health or mental illness situation. Secondly, again, as he indicated in his testimony, there are ongoing indications of a variety of pharmacologic treatments. There's indication of antidepressant medication, of lithium carbonate currently. Previously, there has been treatment with antipsychotic medication. There have been a number of antidepressant medications. And again, as we've heard testimony, there's no doubt that such medications suggest that a number of people on the jail treatment team have believed that Mr. Wilson was psychiatrically impaired or psychiatrically ill, and that his condition warranted ongoing medications. Jails as a group, and I visited scores literally of jails, tend not to treat with medications unless they need to, because one, medications are expensive, two, medications require monitoring, and three, medications have potentially significant side effects. So good clinicians avoid medications unless there's a fairly clear-cut indication for the need for treatment.
Were you aware of whether or not Mr. Wilson is, or at the time at least that you interviewed Mr. Wilson, he was on medication?
Yes, he was on medication at the time that I saw him.
What medicines?
As I recall, I know he was on the lithium, which he had just recently started, and I believe he was on one of the antidepressants, Paxil, 40 milligrams per day at bedtime.
What's the lithium for?
Lithium is a so-called mood stabilizer. It's been around since the late 40s, early 50s, found out by a psychiatrist named Jonathan Cade in Australia, and has been used to dampen down the mood swings that often accompany bipolar disorder.
Now, the time you did get to talk to Mr. Wilson, how long were you with him?
On the first occasion, I was with him a little more than 2 hours. Then I returned, and Ms. Perez was with me on that occasion. Then I returned with her that afternoon to continue my evaluation, and he basically said, he actually didn't come forward. He told the jail staff that he was not going to continue his evaluation. I remonstrated gently and said, is there a way that perhaps I could go back and perhaps you could ask him again to come out? They kindly did that. He again refused, so he didn't come out. And that was, let me check my notes here, but that was in the end of last month, the end of May. Then I came back, that was May 29th. I returned a week or so later in order to evaluate him, and that was on June 14th, and thought that he might be more forthcoming. And in fact, I spoke to you and suggested that perhaps you might encourage him to be more forthcoming. And I know you talked to him, your client, and indeed, I was hoping that he would come out and we could start talking. He did come out. He made primarily eye contact with Ms. Perez, although he looked over at me occasionally and spoke with me occasionally, but indicated he did not want to go forward. We had additional colloquy. I then left because he seemed more comfortable speaking with Ms. Perez. She then asked me to come back. We all agreed we would go forward, but he was very concerned that there were jail staff outside. We were in the lawyer room you previously heard described, with a glass partition between him and Ms. Perez and myself in a slot where you could pass documents. And he indicated that he was very concerned that jail staff was outside his portion of the room and they were overhearing his comments. So he asked me if I would go talk to them. I did. I explained that he was very concerned. In fact, I perceived him as frightened. And could they back away, please? They agreed to do that. He said then finally he was still too uncomfortable to proceed, and so we did not.
Okay. Did you have an opportunity to have him perform any testing like Dr. Eisenstein had described?
Yeah, I mean, as a psychiatrist, I don't do a lot of testing, but I was tutored in the administration of various so-called personality tests. I say so-called because although they're called personality tests, the Minnesota Multiphasic Personality Inventory and the Personality Assessment Inventory, they're really tests of major mental illness, tests of psychopathology. And I asked Ms. Perez to administer one, to watch him, basically just giving him the piece of paper, say, read the instructions and answer the questions. And she had done that, and I got that score, that test back and scored it. And then I asked him, which he did, to do the personality assessment inventory. So we had two psychological tests which were administered in the presence of either Ms. Perez or myself, and which were subsequently scored.
And what did his scores indicate to you?
His scores indicated that he was non-compliant, that he answered the questions, that's kind of partial compliance, but that he invalidated each test by exaggerating symptoms that most people do not have, or most people do not have to that same degree. So, in effect, he said, wow, I've got every symptom in the book, and of course every symptom in the book is many too many symptoms. Even people who are seriously ill only have some symptoms.
Okay. Well, it doesn't sound like you gleaned a lot of information from him, but you did talk to his parents, did you not?
No, I did, but let's go back. I mean, I certainly gleaned information that he could, when he chose to, listen to a question and pay attention, that when he chose to, he could make eye contact and articulate a reason for responding or not. 3, that throughout his time with me, he appeared very wary, very watchful, concerned about who was listening or might not be listening. So I had a sense of excessive vigilance or hypervigilance, maybe even of paranoia. And so I gleaned those psychiatric impressions pretty solidly even after the first couple hours of the first session. And those impressions were bolstered or added onto even by his non-compliance in the second and third session.
Did he ever express any delusional aspects?
Not with me. I mean, he indicated that the guards were listening. The guards might have been listening. I couldn't rule that out. I mean, he didn't tell me that little green men were listening. So they weren't obviously delusional. On the other hand, when I went out to speak with the guards on the third session, they were well away from the door. They were talking to one another, and they didn't appear particularly interested in what Mr. Wilson was saying to me. So could it have been delusional? Possibly. Was it clear-cut delusion? No.
You mentioned little green men. Were you aware that Mr. Wilson, at points in time in his history, had experienced hallucinations?
Well, I know that's been reported. He has never told me that. So he did tell Dr. Eisenstein that, and so I'm inclined to believe that he has experienced hallucinations. It's complicated in his case because obviously hallucinations, particularly auditory sound hallucinations, voices, are a common concomitant of psychotic illness, of major mental illness. On the other hand, visual hallucinations are a frequent concomitant of many street drugs, particularly the hallucinogens like LSD, sometimes amphetamines, and sometimes drugs like MDMA. So all of these drugs can cause hallucinations, and occasionally recreational drugs cause auditory hallucinations. So the presence or absence of a hallucination per se doesn't tell us very much. What matters is there a recurrent pattern? What do the voices indicate? I mean, are they persecutory? You're a bad person? Are they critical? Are they self-injurious? Hurt yourself, kill yourself? One has to make further inquiry. Sadly, at least insofar as my interactions with Mr. Wilson were concerned, he never did that with me.
Okay. You heard Dr. Eisenstein's testimony about numerous head injuries over his youth and into his adulthood. Were you able to glean the same information from your interviews?
No, I mean, I was able, well, yes, if you mean the interview with his parents or adoptive parents, no, I was not able to glean it from him.
Okay, so you got that same information from his parents?
Yes.
All right. And did you make note when you were going through the medical records that there were CT scans that were performed?
I did. In fact, we heard both on direct and cross-examination of Dr. Eisenberg some colloquy about that.
Now, are you familiar with CT scans?
Sure.
Have you seen CT scans before in your practice?
I've seen them. I've reviewed them. I've reviewed the reports for them. CT is computerized tomography. It's a series of X-rays taken from multiple perspectives. It's combined into an overall scan, and then those scans are read by a radiologist, a neuroradiologist, or a neurologist typically.
Now, are they valuable in determining whether or not there's brain trauma?
Well, they're valuable in determining whether there's acute and substantial brain trauma. So if Mr. Wilson had a fractured skull, if he had acute bleeding, the CT is the best way to detect those kinds of gross injuries very rapidly. On the other hand, for more subtle injuries that don't involve significant bleeding and may involve issues to the brain parenchyma, to the brain tissue, they are relatively insensitive methods of learning about that kind of injury.
What type of testing would you expect if somebody was going to conduct those examinations?
Well, the best high-resolution scan for anatomical lesions these days is the MRI, and so for significant but minor cumulative injuries, the high Tesla MRI is by far the best method for learning about the nature of those injuries. High Tesla, high-resolution scans can reveal so-called axonal, shearing, breaking of the long part of the brain cell, and can also reflect any other kinds of minor issues of blood flow or even brain parenchymal death. So MRI is clearly the best scan for that. For issues of brain function, brains obviously, like the rest of the body, metabolize. They take in sugar and oxygen and convert that to energy and obviously carbon dioxide. And so there are scans that look at metabolic activity in the brain. Those scans are particularly called PET. Those aren't very high resolution scans, but they're very good at looking at what part of the brain is active and what part of the brain is not so active.
Did you have an opportunity to determine whether or not there had been any PET scans or MRIs done of Mr. Wilson?
Well, I asked that question of his parents, and of course, most of the time when I spoke to his parents, the elder sister, the radiologist, Wendy, was also there, and they all indicated that they were unaware of any of those scans ever having been used for Mr. Wilson. So I don't know for sure they're correct, but assuming that they are, no such scans have been given to him.
Okay. Well, why don't you tell us what information you were able to obtain by your interviews, by your interview of Mr. Wilson, his parents, his sister, the information you gleaned from the records, and your discussions with Dr. Eisenstein.
Sure. Well, in overall, I think the evidence is that Mr. Wilson was adopted at a very early age and appeared to function as a normal member of the family from the age of his adoption at an age of a few months until sometime in around, it's from my notes here, in around 2007. His mother and his father both report that he became, over that summer between school terms, he became increasingly isolated, reclusive, hostile, paranoid, different, significantly different. On her own, Mrs. Wilson said, look, I've had two other kids, two daughters. I understand boys and girls are different, but I've had two other kids, and sure, they change around adolescent, but they didn't go, if you will, from Dr. Jekyll to Mr. Hyde. They didn't go from day to night. They didn't go from an active member of the family to a reluctant, scared, hostile participant, occasionally only in the family. So she describes a very significant change.
Were you aware that his biological mother may have had mental health issues?
I learned that. I hadn't known that. I learned that from, I guess her name is Candy, from Mrs. Wilson, the mom.
Okay. And is that something that can be passed on to a child?
Well, it's significant information. The most serious psychiatric illnesses, of course, are the psychoses, are schizophrenia and bipolar disorder, paranoid disorder, schizoaffective disorder, that group. And for the psychotic illnesses, the heritability is very high, so that if a mom or a dad has it, the likelihood of a child having a psychotic illness goes from about 1%, which is the general rate in the population, potentially as high as up to 50%. Depends on the nature of the illness and the study, but there's a huge increase in the likelihood of manifesting such illnesses if one, let alone two parents, have significant psychiatric disorders.
There's no way for you to be able to tell test whether or not Mr. Wilson actually obtained this mental illness from his mother, though, is there?
No.
Okay. So did you make any diagnosis or determinations based upon the information that you had?
Yeah, my diagnosis and belief is that Mr. Wilson has some kind of psychotic disorder. Sadly, because he was not particularly forthcoming with me, I can't characterize it very well. Generally, when I testify, I have more information both from the evaluee, both from the defendant in a case like this, and I have more information from prior hospital records, from Baker Act hospitalizations, from other psychiatric hospitalizations, and I can characterize that disorder pretty well. Here we've heard about mood swings that could suggest bipolar disorder. We heard about a diagnosis of schizoaffective disorder in the JO records. There's a good study going back to really my time in medical school called The Stages of Mania, which says, 1972 was the date of the study, you can't distinguish acutely between schizophrenia, bipolar disorder, and schizoaffective disorder. So I don't know exactly what Mr. Wilson has, but I think it is very significant, and I think it is a psychotic level illness, and his degree of paranoia we haven't come to all the examples yet, but some of the examples the parents told me about are quite striking. I'll give you one, that at some point Mr. Wilson's mother, Candy's father, perished, and that the family moved into his home. And in the morning, everybody would get up, and I guess people would go to school, and she would, of course, Mrs. Wilson would go up, would make breakfast for the family, and would open the curtains, and the house would sort of be functioning. Well, Mr. Wilson, as a kid, and he was 15 or 16 at this point.
That's Wade Wilson.
That's Wade Wilson, yeah. As a kid, age 15 or 16, would go around and systematically close the curtains. And at some point, probably the first or second time, Mrs. Wilson recalled saying, well, why are you doing this? What's wrong? What's going on? And he said, there are people out there. And she said, okay. And he said, they're going to harm me. And she said, are you sure? He said, they're going to harm you too, Mom. They're going to harm the family. And he was very upset. And this happened more than once. That is, he had an apparent belief that others were intending to harm him and the family for reasons that were never specified. Now that sounds, frankly, not only paranoid, but delusional. It isn't just that he was frightened or scared, but he had turned that fear into an entity or a group of entities who were planning to harm him and the family.
Okay. How would that psychotic behavior manifest itself into a 25-year-old Wade Wilson?
Well, I mean, in psychotic disorders generally, you have disruptions in thinking, you have disruptions in affect or in emotion, you have disruptions in functioning. So as a younger person, you function primarily in school. As an older person, we function in work. So Mr. Wilson has never had enduring, productive, successful jobs. He hasn't had long-term significant emotions. His social functioning beyond work has been, frankly, crimes and jail time. He is not functioning well. Although we heard that his high school transcript and his grades were pretty good, and he was roughly in the middle of a class, we also heard from Dr. Eisenstein that he has significant neurocognitive disorders, some of which are quite focal, although quite specific. So that's a problem. His emotions, we heard from the family, and we heard again in the brief letter from the sister, that his emotions were up and down, that he was often very depressed. The jail records are unambiguous that he says he's depressed, that he's seeking medication, that he wants treatment. I think his emotional states are dysregulated. They don't follow the way emotional states ordinarily should.
But does it appear from the record and your conversations with the family that Mr. Wilson was able to obtain the treatment that he desired?
Well, I mean, he got some treatment in jail and witnessed his present level of medication, but he never got adequate assessment any time, near as I can tell. That's one of the problems with his situation and with this sad case, that no psychiatrist or psychologist as a team has ever systematically diagnosed him, begun him on a course of medication which he stayed with and which he tried, and no one has ever been able to determine if he really would respond to medication over a long period of time or not. The Paxil he's on is moderately effective for people with classic depression. He clearly has something beyond classic depression, whether it's major depressive disorder or dysthymic disorder. His depression or his emotional state is more badly affected than those with typical depressions, and his thinking is very clearly disrupted. We heard Dr. Eisenstein describe the kind of specific thinking disruption that he suffers from, but his thinking is, if you will, messed up beyond ordinary thinking. This is not somebody who's just burnt out because he did some bad drugs when he was in high school. This is somebody who's had significant thought disruption going back even before, even just contemporaneous with high school, before he was abusing drugs.
And with this psychotic behavior that he exhibits, how would ingestion of controlled substances affect that?
Well, and you can't really answer that question. The broad answer is it affects people individually. And just like psychotic symptoms vary person to person, and in fact, even with one person over time, the ingestion of drugs affects people variously. We know certain drugs, cocaine, amphetamine, are activating, tend to make person more volatile, more short-tempered, angrier, so that would be true. With those drugs, the opioids as a group tend to make people more relaxed, more passive. We know that cannabis or marijuana tends to make people more passive in general. And we know that for people who use a lot of cannabis early on, there are major neurocognitive consequences. A New Zealand study about 5 years ago demonstrated that the person who uses marijuana heavily at ages 13, 14, and 15 loses between 10 and 15 IQ points by the time they're 18 or 20. That's a major reduction in cognitive skills. So each of these drugs affects people differently, and each of these drugs affects individuals differently.
Now, you heard Dr. Eisenstein's testimony about the chronology of trauma to the head. We'll call it trauma to the head.
Fair enough.
We don't have enough testing or anything else to determine how substantial any trauma to the brain was. But did you take into consideration the head trauma?
Yeah, I mean, look, he may or may not have had significant head trauma. We don't have clear evidence about that. But we do know, and we didn't get there in Dr. Eisenstein's testimony, that there are neurocognitive disorders associated with the psychotic disorders. So people with schizophrenia in particular often exhibit changes, particularly changes in frontal lobe functioning as part of their illness. And that's been around, that knowledge has been around 35 years, that people with schizophrenia or schizoaffective disorder or psychotic disorders have significant neurocognitive problems, particularly frontal and prefrontal lobe problems, and those problems are things like perseveration. So that the finding, the significant finding, what was it, 7 standards of deviation below the mean, that kind of finding could be accounted for just by his psychotic disorder, with or without any kind of brain trauma.
Okay. May I have a moment?
You may.
You mentioned a term, perseveration.
Perseveration?
I've mispronounced it twice today. Perseveration. What exactly is that?
That means you keep doing the same thing repetitively and ineffectively. So that, I mean, I think as Dr. Eisenstein was explaining, if you have a card sort and you initially get the program right, you figure out it's a number or it's a design, or I've forgotten what the other one was, and then you assign new cards to that correctly, and then all of a sudden you lose that and you don't figure out what's going on, and as you persevere, you go forward with the old unsuccessful pattern, and that's perseveration.
Based on the information that you have, I think you told us before that he hasn't had a team work on him, a psychologist and a psychiatrist working together, maybe with a neurologist. Is it possible to fix Mr. Wilson?
I doubt that. I think it's possible to diagnose him better. I think it's possible to give him medications which would help him function significantly better. I mean, first of all, it's impossible to address the tragedy that brings us all here. That's happened. But beyond that, we can't fix him. We can't give him an IQ of 140. We can't make him a modern day Einstein. We can't fully address these problems, but we can address some of them probably.
Okay. I don't have any further questions. Thank you. Oh, may I?
Yes.
You're appointed by the court to assist us in our defense, is that correct?
Yes.
And you get paid?
I hope so. I haven't billed yet, but it's my intention that JAC will pay me.
Okay. That's a state agency?
Yes, here in Florida.
Yeah, the same one that pays Dr. Eisenstein?
Yes, and hopefully you too.
Okay. And what is your hourly rate?
$400 an hour.
Do you know if you have exhausted your initial time?
I don't believe I have, but I haven't even calculated it yet. I mean, the initial, I thought we would be done with trial last Friday, and one of the things I needed to do this week was to calculate my time, but I still haven't done that.
Do you have any idea, can you at least estimate how many hours you have in on this?
I think I estimated in my deposition something like 20 plus some travel time. It's somewhere around there.
Okay. I don't have further questions. Thank you.
Good afternoon, Dr. Mills.
Oh, good afternoon, Ms. Miller.
I just want to clarify something the defense just asked. He asked if you were appointed by the court. The defense actually sought you out and chose you to be their expert. Is that correct?
I don't actually know the precise order, but I think Ms. Perez called me and said, would I be willing to take an appointment? And I said yes.
Okay, go ahead. I'm sorry.
Thank you. And, how the system works beyond that, I do know that ultimately JAC signed off on it, but exactly who said what to whom when, I don't know.
So defense has their own mitigation expert, Wendy Perez, who's sitting here in court. Is that correct?
Yes.
And she helps to get doctors for this case, and then the court orders payment of those doctors that are chosen.
Yeah, I think you're missing the JAC step in there, but fundamentally what you're describing is correct insofar as I know.
Okay. Now, you've worked exclusively as a forensic psychiatrist for the past 37 years.
Yes.
And you've testified on approximately 15 to 20 capital cases.
Yes.
And you're currently working on 5 or 6 capital cases.
Yes.
All for the defense.
Yes.
And you haven't had a regular practice seeing your own patients since about 2007?
Well, I don't mean to be quarrelsome, but my forensic practice is my regular practice.
Sure. A private. You don't have a private practice where patients come for therapy or for you to prescribe drugs.
Yes, although many of my engagements are private in the sense that it's not through a state agency or the DOJ or any other kind of agency. It's a private attorney or a private party retains me.
Okay. Now, in defense for capital.
Pardon me?
Defense for capital. Only defense attorneys.
No. I've done plenty of prosecutorial cases.
I'm talking about for capital cases, sir.
For capital cases, no. They've been all defense cases.
All defense. All right. Now, you mentioned you're not licensed to practice in the state of Florida.
That's correct.
So if the defendant took medication or needed medication, you won't be able to prescribe it.
No, I could call a colleague and suggest that she or he prescribe medication, but it would be her or his ultimate decision.
Now, it's my understanding that prior to meeting with the defendant in this case, you did not want to review materials. You wanted a blank slate.
Yeah, and I explained that to you in our deposition, which I guess was on Saturday.
Well, and I appreciate what you explained to me, but I'm asking questions so the jury now can understand the questions that I'm asking you. So I'm asking them for their benefit, not for mine. But when you met with him, you only knew basic information about this case.
That's correct.
So you didn't know a whole lot about the facts and details before meeting with him.
Yes.
And when you went and met with him the first time, he was somewhat uncooperative.
Well, he was initially cooperative and he agreed to do the testing, but then when I began asking him more information, he became, from my perspective, more guarded and ultimately hostile, and then indicated he wanted to stop with the questions.
He wasn't trusting of you, you didn't feel?
That's how it appeared to me. That's correct.
You felt he was somewhat paranoid?
Yes.
But there were no statements he made to you suggesting that it was just his behavior, correct?
Well, his statements were saying that, he hadn't engaged in the alleged conduct here. That was a statement that struck me as obviously aberrant, where A, he had been, at that point he had not yet been convicted, but B, I had heard there is very substantial evidence at that point.
Well, so that's an adverse comment. That's something that's not correct, but that's not paranoid, correct?
Well, it certainly may be paranoid. It's not delusional.
Okay. Now, he wasn't talking nonsense.
He was not.
He wasn't agitated in an abnormal way.
That's correct.
He exhibited no indications of mania.
He did not.
Now, the second time you went to meet with him, you indicated that he was very concerned about jail staff listening.
No, that was the third time.
Okay, so let's talk about the third time. He was very concerned about jail staff listening.
Yes.
And you would agree that a meeting where you're supposed to be getting personal, very personal information from somebody, that confidentiality is of the utmost importance.
Yeah, I think in general that psychiatric, particularly forensic psychiatric evaluations, should be confidential, and that's why I acceded to his request to talk to the jail staff who was there and to encourage them to move away from the door, as I did.
So as far as him wanting that privacy and that confidentiality, that's not an abnormal request.
No, again, but you can, I mean, if you say, Doctor, I'm a little concerned that the staff might be listening, that's one thing. If you say, I don't want to go forward, and I say, how come? Staff could be listening. You know, the manner in which the comment is made or the issues are presented varies considerably. And although there was a rational component, I mean, nobody wants confidential material discussed in public. On the other hand, there was a irrational kind of hyper-wary sense that I need special treatment here. Something is not right. I was hired to try to help them.
You agree that you were in the court facility when you conducted this interview, or the jail?
The court facility.
You would agree that it's actually very echoey.
It's very what?
It echoes. So there's a big echo to it.
Not where I was, but I mean, I guess there are multiple rooms there. I didn't see it as very echoey.
You have to speak up. Would you agree?
Well, he was right next to the slot, again, as Dr. Eisenstein described, so I mean, I could hear him pretty well.
Now, you indicated that you did MMPI testing and PAI testing.
Well, I indicated that Ms. Perez did the MMPI. I administered the PAI, but that's correct.
Okay, so he was given both inventories.
Yes.
And both are personality inventories.
Yes, and as you've heard me describe, they're both tests really of psychopathology.
And I'm just going to ask you, I'm asking you very specific questions, so I'd ask you just to limit your response to what I'm asking. But as far as these tests go, are they both accepted testing among the psychological community?
Yes.
And these are tests that you perform consistently in your line of work?
Yes.
And you conducted these tests, or the Wendy Perez did, and you determined they were invalid.
Yes.
And so because these tests were determined to be invalid, you weren't unable to give any clinical interpretation to these tests.
That's correct.
And these tests can be invalid by someone with a really low IQ.
Yes.
However, the defendant doesn't have a really low IQ.
That's correct.
The test can be invalid because of a different linguistic culture.
Yes.
And you're unaware of the defendant having a different linguistic culture.
No, on the contrary. I mean, I think he has the same linguistic culture.
And the test can be invalid because of a different just culture in general.
Less likely, but yes.
Okay. And there's no indication that the defendant comes from a different cultural background.
Correct.
The test can also be invalid because of exaggeration.
Yes.
And after these two tests were completed, that's when he refused to meet with you any further.
Yes.
And you were unable to get any other information directly from him.
No, remember the testing was concluded, one before I ever saw him and the second one at the end of the first session. I was able to get some information in the third session, but not anywhere near as much as I had hoped.
And the information in the third session, what indications in that third session did he give you with regard to his mental illness?
Well, regard to his mental illness was his extreme wariness about going forward without the jailers moving away, and even when I arranged to have them moved away, he still wouldn't go forward. That was pretty extreme. It was, to my mind.
So that's the additional information that you got.
You cut me off, ma'am. I'm sure you didn't mean to. But to my mind, that was an indication of his enduring paranoia.
Other than how he acted, was there any other information that he gave you during that meeting?
Well, I mean, other than the death, I mean, how did you enjoy the play, Mrs. Lincoln? I mean, if something is fundamentally wrong with the way he's interacting, that's a serious problem.
Other than his interaction, did he tell you or say anything else during that session to you regarding his mental health?
Let me take a quick look at my notes, and I'll answer the question as best I can. Well, he started off by saying he refused to answer any more questions, even though Ms. Perez had asked him, how you doing? And he said, I'm doing okay. And then she said something like, how's it going with the attorneys? And he started on a kind of a diatribe, an angry critique of them. So that wasn't relevant to my particular observations, especially except that he seemed unusually critical, and it was my understanding by this point that there had been some recent interactions between counsel and client that had been somewhat positive. At least that's my understanding from Mr. Shirley. So I was surprised by that. Again, it made me wonder about his level of paranoia. It wasn't dramatic. Again, it wasn't like Little Green Men, but it was something.
During this third meeting, did he tell you anything about his mental health?
Fundamentally, no.
Thank you. Now, you mentioned about the jails, and you questioned basically the competency of mental health staff in Florida jails.
No, not mental health staff. Staff.
Okay. And you talked about how the records and note-taking is lacking in
Often.
jails. Now, you also said you've been to numerous jails and toured them, is that correct?
Yes, I've done that too, yes.
Have you toured any of the mental health sections in Florida jails?
Only at TGK.
Okay. And did you tour that to see what type of treatment they were offering?
No, I toured that to speak with the director and obtain records on one of the individuals who was there.
Have you ever sat down and looked at Florida inmate records to see how often they're prescribed medication when they request it?
No, but again, I've probably seen the records of 30 serious felons in the last 10 years in Florida. So, I reviewed carefully those mental health records to the extent that they exist.
Okay, so based on these 30 records, it's your belief that inmates are under-medicated?
No, not that they're under-medicated. It's my belief that, sometimes they're under-medicated, sometimes they're probably over-medicated, but it's my belief that the quality of the records is by and large not particularly good, and that the jail staff overall is not so interested in mental health issues, as I testified.
And that's your belief in your review of these 30 people in the state of Florida?
Yeah, I can either base it on studies or on my experience. I haven't seen a study that looks comprehensively at psychiatric treatment in Florida jails and prisons, although I would welcome that. But I have some now, after all these years here, some basis on which to make a observation or two.
Now, someone who is a drug addict, you would agree that they often seek medications?
Sure.
And did you review the jail emails where Mr. Wilson is constantly requesting drug information?
No.
So you're not aware of his medication requests and wanting to know about side effects and what they might do for him?
Well, I've seen that in the jail medical records, but I haven't seen your question was about jail emails.
Correct.
I haven't seen that in the emails because I haven't reviewed those emails.
Now, in the jail records, you would agree that Mr. Wilson he refuses medications.
He has refused medication. He has sought medication. Yes, both.
And again, I'm just going to ask that you answer the question that I ask and not expand, please. Now, when he first came to the jail, he was actually on no psychiatric medications, correct?
Yes.
Okay. Now, you're familiar, doctor, with the DSM-5.
Well, as you correctly said earlier this morning, the DSM-5 has been superannuated. It's been replaced by the DSM-5 TR, which was copywritten 2 years ago in 2022. So that document you're holding is no longer current.
Now, this one, though, that I'm holding, though, the criteria for schizophrenia hasn't changed in the last 2 years. Is that correct?
Well, that's because the one you're holding is 7 years old or 8 years old, whatever it exactly is, and the criteria has changed in DSM-5-TR.
So let me, if I may approach, Your Honor.
You may.
For the record, I'm going to approach and show the doctor some criteria for various mental disorders. Doctor, you agree that the DSM, the most current, is what's used to diagnose patients?
Yeah, you're talking about the DSM-5 or the DSM-5-TR?
DSM-5-TR, the
Okay.
most current.
Yep.
Yeah, I'm going to ask, these came from the DSM-5-TR. I'm going to ask that you just take a look at these and tell me if you recognize these. I'm going to mark them as demonstrative aids, 1, 2, and 3.
Okay. I recognize these.
And do these appear accurate?
Those, due to my recollection now, there are pages of criteria for each one of these, and I don't have them memorized, but I certainly understand the content of them.
Okay. So, and do you have your DSM-5-TR book with you?
No, I don't. It's a little heavy to carry around.
All right. So I want to start by talking about the diagnoses that you made for the defendant in this case. You would agree that many of the things that the defendant says throughout these medical records are self-reporting.
Well, by definition, if you say it, it's a self-report. It may be accurate, it may be inaccurate, but it's a self-report.
Sure. So there's not some blood test or some confirmation. It's just him reporting, I've got these disorders. That's self-reporting, correct?
That's several, but staff obviously can observe and make observations. I mean, if somebody is hunched in their cell,
Sure.
that's different than engaging in a conversation.
And we'll get to that. We'll get to the observations because I would really like to hear what things you found in the record to support your diagnosis. So we'll get to that. You indicated on Friday in your deposition that you had diagnosed him with schizophrenia or schizoid affective disorder. Is that correct?
No, schizoaffective disorder.
Schizoaffective disorder. Those are the two you diagnosed with him when we talked on Friday, correct?
That's correct.
Now, today it sounded like you were expanding it to bipolar or an adjustment disorder or some other type of disorder. Are you going to stick with the schizophrenia and schizoaffective?
I'm not sure I understand your question. I'm not, first of all, adjustment disorder is a totally different category. I mentioned psychotic disorders. So I think psychotic disorder is the broad, correct category, and that would not include adjustment disorder. I personally think bipolar disorder is not as probable as schizoaffective or schizophrenia, and since I can't be more precise, that's why today, after thinking about it some more, I just said psychotic disorder.
Okay, so let's go through schizophrenia. I've marked this as a demonstrative aid, exhibit number 1, Your Honor.
Okay, any objection to these being admitted as demonstrative aids?
If they're demonstrative, they don't have to be admitted.
Right, they won't be admitted as
Okay.
It's just as demonstrative. Okay, so let's go through the DSM-5-TR's version for schizophrenia and what there must be for a diagnosis. Let's talk about delusions.
Okay?
You mentioned that you learned of delusions from his mom and closing the window. Is that correct?
Closing the curtains.
Closing the curtains, all right. Any other delusions that you learned of?
Yes, from the father I learned that he had told his father that there was something noxious or problematic or serious or explosive in the garage, and his father kind of poo-pooed it, and that conversation recurred. So ultimately, the father called the police. The father and the police went through the entire garage, and there was nothing untoward or unexpected in the garage. So that would be another delusion.
Okay, now, With regard to that delusion, did you find out if these delusions last for a 1 month or more period?
Well, from the context of the conversation, they had occurred recurrently over months, if not even years. So I think they certainly fit that portion of the criteria.
Okay, so let's talk about the garage incident. They actually called the police for that incident, correct?
Dad did, yes.
And did they tell you about any other times they had to call the police for that garage incident?
Not for the garage incident, no,
So-
but of course
so the garage incident was really a one-time thing.
No.
Objection, Your Honor. She's interrupting his answer.
Well, Sustained, we finish your answer.
Thank you, Your Honor. No, I think the garage incident was another aspect of there's something out there that's harming me and the family, and yet when examined carefully, there was no such something out there. So I think that's a continuation of the same harming delusion that he has harbored for months or years.
But again, there was no other indication that police were called based on that specific delusion.
Yeah, that's true, but it's irrelevant. But you're correct.
Now, moving on to hallucinations, I think you mentioned that Dr. Eisenstein told you that he reported hallucinations.
No, I think I said that Mr. Wilson reported to Dr. Eisenstein, and then Dr. Eisenstein told me, so that Mr. Wilson reported hallucinations. I didn't get that from him, and I didn't see him acting in a way that suggested that he was experiencing hallucinations.
And I'm going to ask that the witness be limited to answering my questions. He's giving very long narrative answers, adding a lot of information in to the questions I'm asking.
He was just correcting her because she mischaracterized his
I've heard the objection. Just remind the witness that you must be responsive to the attorney's questions.
Thank you, Your Honor.
With regard to hallucinations, what specific hallucination are you aware of that the defendant was experiencing?
I don't know. As you heard Dr. Eisenstein say on his direct, he didn't ask more, and I didn't glean that or gather that material from Mr. Wilson, so I can't characterize his hallucinations beyond that, other than acknowledging that he had them.
Okay, so again, there's not any specific thing that you can point the jurors to with regard to a specific hallucination that the defendant had.
That's correct.
Now, going on to disorganized speech, did you find any evidence of disorganized speech?
No.
And any evidence of grossly disorganized or catatonic behavior?
Not that I'm aware of.
Any negative symptoms, diminished emotional expression, or avolition?
Yeah, I think probably, I mean, first of all, you only need 2 of the 5, and I think we've already gotten the 2 from my perspective with the delusions and the hallucinations. But beyond that, I think the negative symptoms of social withdrawal, I would use the psychiatric term, anhedonia, without the ability to take pleasure, depending on drugs for some kind of balm or soothing, I think that all suggests negative symptoms, and his going from sort of being averagely interactive to being reclusive and isolating himself either in his room or in the house or whatever.
You would agree, sir, that drugs also can cause some of these delusions or hallucinations?
They can.
Now, I want to go on to your further review of the record. You reviewed the affidavit and application for the arrest warrant from the state's discovery, is that correct?
Yes.
And that was 11 pages.
Yes.
Did you review the statement made by Joshua Lukic, who called 911 regarding the defendant telling him he had just killed 2 women?
Yes.
And when did you review that? Over lunch?
No, I think I reviewed it yesterday afternoon.
Okay. And did you listen to the 911 call?
No.
Okay. Do you think that if in the statement to Lukic, he actually told him that he killed 2 women, right?
Yes.
And if the defendant said he just killed the devil, that would be delusional.
Yes.
And he said he killed 2 women, and that would be accurate, so not delusional, correct?
Yes.
And there was nothing that he said in his statement to Mr. Lukic that would cause you to believe that he was delusional at the time.
That's correct.
Now, did you review the statement of Stephanie Johnson, who was with the defendant throughout the evening and morning of the murder?
I believe I did early on, in the last few weeks, but not recently.
Okay. Now, when we met on Friday, you indicated you hadn't reviewed those statements,
I
correct?
think, yeah, I just didn't remember, but I think I had reviewed them previously.
Okay, so Stephanie Johnson, who was she?
She's, you know, the witness who was, I can't even remember exactly, but I did review it.
Okay, so you don't remember, but there was nothing in her statement that indicated that Wade Wilson was hallucinating prior to killing the two women.
Nothing that I found in there, that's correct.
And there was nothing in that statement that indicated that he was suffering from delusions.
Correct.
And you would agree that a delusion isn't something you just pop in and out of. So he wouldn't be non-delusional and then an hour later delusional and then an hour later non-delusional.
That's correct, except particularly people who are paranoid very often don't discuss their delusions with anybody. In fact, to the extent that Mr. Wilson has delusions, I couldn't get him to discuss them with me, even though he knows I'm part of the defense team.
Now in Stephanie Johnson's statement, though, you saw no evidence of paranoia.
That's correct.
And did you review the statement of Melissa Montanez and her interactions with the defendant on October 6th and 7th?
I read her, 50-page, 60-page deposition, yes.
And when did you review that, doctor?
Oh, a couple weeks ago.
Now, when we met on Friday at your deposition, you indicated you had not reviewed that statement.
No, that was a mistake on my part.
Okay, so now you're saying that you reviewed it.
Now I'm saying, I am saying.
Okay, so, and who was Melissa Montanez?
She was the woman who was also assaulted in this series of sad events.
And did he appear to be hallucinating when he beat her up?
Not to her, but of course, I mean, if you're really in apprehension of being seriously injured, you're probably not wondering so much about what's in his mental state. You're wondering about how to protect yourself.
Okay, but again, doctor, there's no evidence of hallucination when he's beating her up.
That's correct. I mean, look, had there been such evidence, this case would have been an insanity case. This is not an insanity case.
Okay. And you actually, you're aware then that they actually agreed to meet at that Mila Spa.
Yes.
And you're aware that they later agreed to meet at Joe's Crab Shack.
Yes.
Now, did you review Shayna Williamson or Don Griffin or Amy Slobodazan's statement regarding what they witnessed?
I did not.
And did you review the statement he made to Timothy McCormick after the defendant murdered Diane Ruiz and Kristine Melton?
No.
And did you watch the video of the defendant's interaction with the officer?
No.
Don't you think that interaction might be important to gauge whether he was experiencing any hallucinations or delusions?
If one was only interested in his mental state at that moment, absolutely. If one's interested in his mental state more longitudinally over time, I don't think it would have made much difference. I mean, the evidence from my perspective is he's had serious mental illness for a long, long time. Whether it flared up in and around the time of these tragic events is a different question, and I don't have an opinion about that. I just believe that he is chronically mentally ill, chronically and severely.
Well, doctor, you indicated that you actually had a hard time getting information for this case because, number one, the defendant wasn't extremely cooperative. Number two, there weren't records outside the jail medical records. And you would agree, and you said, I think in your testimony, that the jail medical records had limited value.
Yes to all of that.
So, but you're saying that you didn't think the incidents or the situations surrounding the crime were that important for a diagnosis of schizophrenia or schizoaffective disorder?
A diagnosis over the months and years of his life. That's correct. I mean, look, they are obviously directly relevant to what occurred here, and to the extent that had there been such strong evidence, this would have been, as I indicated, an insanity defense case. This is not an insanity defense case. The evidence apparently was very clear. The jury deliberated and reached a conclusion relatively quickly.
Now, doctor, did you listen to a statement where he confessed to the murder?
Yes.
And did you find that he was hallucinating?
Not at that point,
And
insofar as I could determine. I mean, his response seemed without hallucinations or frank delusions.
Okay. And it appeared that in that statement that he gave 3 days later to law enforcement that he was able to appropriately answer the questions.
Insofar as I know, perhaps. I mean, in some cases, the evidence is not very clear.
Now, you reviewed the jail medical records.
Yes.
And you would agree that most everything in those records was either self-reported or there wasn't anything at length regarding symptoms that the defendant had.
Well, and you know, I mean, it seems to me you're turning around my statement. I said that one of the problems with these records is very often jail records aren't very interested in describing an individual's mental state. You're right. I mean, so they're not very long, very detailed statements of observations about his appearance or style of interaction or whatever.
And those kinds of observations and those kinds of notations are a critical component of diagnosing someone with a psychotic disorder.
They certainly can well be, except we have other significant information about a seemingly okay kid who becomes very reclusive, who starts doing drugs, who starts getting significantly arrested, whose crimes appear to be escalating, and who appears to be having other difficulties, correct?
And I'll get to that. I just want to go through step by step the jail records and the various records you reviewed. Now, would you expect to see over a 10-year period of someone who suffered from schizophrenia to have numerous Baker Acts?
No, it depends so much on where they are. I mean, if they were living on the street, yes. If they were living in an affluent, educated home, perhaps not. So, you know, it really depends on what's occurring around them. Obviously, in Mr. Wilson's case, he's also spent a fair amount of time in custody. So once in custody, he's not going to be Baker Acted out of custody.
But you saw no significant notes in those 10 years of records regarding symptoms of schizophrenia.
That's correct. But again, you've heard me say now twice that oftentimes jails are concerned with security and control. They're not interested in somebody's mental state, so they're not making systematic observations, let alone drawing conclusions from those observations about an individual's mental state.
But again, I just want to answer to that question. There was nothing significant in 10 years of records to show symptoms of schizophrenia.
I think that's accurate.
Now, as far as family information that you relied heavily on, he was actually only Baker Acted once, by his father. Is that correct?
Yes.
And his dad called because he found drugs.
Yes.
And he was actually released the next day.
Yes.
And a teenager who would be Baker Acted for a serious mental illness like schizophrenia or schizoid affective disorder, you would not expect them to be released the next day. Is that correct?
Well, I mean, here's the problem with your question, that we don't have those records. We have the parents' recollection of what occurred. And I asked Ms. Perez, as soon as I first learned this information from the parents, I said, in effect, gee, can't we get those records? And she said, I tried hard. That mental state, that mental health center, I should say, is no longer in business. Those records are no longer available. So we don't know what transpired to have him released relatively quickly.
Okay, so, but at the end of the day, to just be released the next day would be unusual. You would agree?
It depends how he appeared, and it depends how the staff took the indications for his initial hospitalization. Without the records, it's very hard to draw any firm conclusions.
Now, you would agree that reclusiveness could be associated with drug use?
Yeah, except that the sequence is wrong here. Yes, I mean, it could be, but the parents describe his reclusiveness preceding his returning to high school and then later abusing drugs. They could be wrong, of course, but that's how they perceived it.
So, reclusiveness can be associated with drug use.
It can be, yes.
Becoming uncooperative can be associated with drug use.
Yes.
And in fact, the defendant told Dr. Eisenstein that he had been using drugs very heavily at the age of 13.
Yes.
And his sister believed he was taking amphetamines.
Yes.
Amphetamines can cause mood changes.
I'm sorry, say again?
Amphetamines can cause mood changes.
Of course.
Amphetamines can cause paranoia.
Yes.
And you agree the family was able to give general information, but not a lot of specifics due to a lack of any type of records.
Yeah, I mean, I don't know if it's lack of records or lack of recollection or the emotional trauma of what was occurring, but for whatever reason, they did not have good specific information. They had very clear impressionistic sense of what had occurred gradually.
So you were provided no mental health records by the family?
Correct.
No medical records by the family?
Well, again, we heard from Dr. Eisenberg that those records, to the extent the family may have had them, there was a period where there was some kind of fire and they lost what may have been significant records.
So they were able to provide no medical records to you,
Yes,
no prescription records,
correct.
and you actually determined he was grossly paranoid and apparently psychotic.
Yes, I still believe that.
And the family of the defendant, the mom said that he was different than the sisters, but the sisters had no use of drugs, correct?
Insofar as I'm aware, correct.
And you looked at his school records.
Yes,
He got mostly A, B's, and C's other than math.
yes,
And he got expelled for selling drugs.
yes,
It was not for hallucinations or paranoia.
correct.
And you talked to Dr. Eisenstein,
Yes,
and he told you that the defendant had been suicidal.
well, he told me that the defendant told him that he had been suicidal,
Okay.
correct,
And suicide can be a sign of depression.
of course.
Suicide can be a symptom of drug use.
Yeah, I mean, generally the intermediate step is depression, but yeah, it can be.
And you would agree that these hallucinations that Dr. Eisenstein reported to you, he didn't give you any details about them.
That's correct.
And the symptoms in which you base your diagnosis, other than observing some paranoia, are not ones that you observed or heard firsthand from the defendant.
That's correct.
And many of these symptoms are not in the jail records.
True, for the reasons we've discussed, yes.
The defendant reported to the investigator that his diagnosis was ADD.
Well, he may well have that, but yes, but it hasn't been fully explored.
Okay. And in fact, his family, the school records don't support a diagnosis. There's no diagnosis in the school records.
That's correct.
And none of the actual facts, the witness statements of the case that you reviewed, show any evidence of hallucinations or delusions.
In and around time of these events, that's correct.
And you're sticking by your diagnosis today as some sort of psychotic disorder, specifically schizophrenia and schizoaffective disorder. Is that correct?
Well, when you say sticking with your diagnosis, that sort of demeans it. I mean, I spent some hours trying to come up with the best understanding of his diagnosis as I could, given the admittedly limited records that are available to me and his uncooperativeness. That is my best understanding of his psychiatric condition, but I'm not sticking with it. That's the diagnosis that I came up with after spending some time thinking about it.
Okay, so you're testifying here today that it's either schizophrenia or schizoaffective disorder.
Well, and let's just call it generally a psychotic disorder, yes.
No further questions. Thank you.
Doctor, let me clear up something. You've been licensed or practicing as a psychiatrist or forensic psychiatrist for 50 years, have you not?
Only 49, I think.
49. What types of other engagements have you had during those 49 years?
Well, I was the Commissioner of Mental Health in Massachusetts, so I had 32,000 employees when I was 36 years old, and I ran the state's largest single agency. I was the chief of psychiatry at the largest psychiatric hospital in North America, the West Los Angeles Veterans Administration Medical Center. We had about 500 inpatient beds and did more than 200,000 outpatient visits a year. I've been the director of 2 psychiatry and law programs, one at Massachusetts Mental Health Center with Tom Gutile, and one at the UCLA Neuropsychiatric Institute in Los Angeles. And I've been an assistant or an associate or full professor both at UCLA and at Columbia University in New York, also at Georgetown and at New York Medical College in New York.
Did you testify at the request of numerous judges in the state of New York?
I have in federal cases, yes, sir. I did a couple of national security cases, and then I've been a judge's expert in Virginia with chief judge on a case of involving competency to be executed. I was the district court judge, federal district court judge's expert in a double homicide in Los Angeles.
The, you aren't licensed in the state of Florida, but you don't have a clinical office here in the state of Florida, do you?
No, and you know, look, I mean, as you well know, laws change jurisdiction to jurisdiction. So, you know, it might make sense to have a different law license in Florida than in Virginia or in Georgia. But psychiatric disorders, medical conditions don't vary when you drive from Georgia to Florida or from Georgia to West Virginia or whatever. So the rationale for medical license is quite different than the rationale for a legal licensure.
In the type of practice that you have now, you don't need a license.
Well, yeah, I need a license somewhere, but I am licensed. I mean, every state has its own additional requirements. The more licenses you have, the more additional hoops you have to jump through, and you have to pay a licensing fee the more licenses you have. I could theoretically have 10 licenses. No, thank you. One set of hoops is enough.
Nevertheless, you've been permitted to testify as a forensic psychiatrist in numerous jurisdictions here in the state of Florida.
Yeah, many times. That's correct, sir.
Okay. The prosecutor asked you a couple of minutes ago about school records. There wasn't any mental health information in the school records that you saw. As a matter of fact, the only thing that was in the school records was basically his grades. Isn't that correct?
That's correct. I mean, it's a one-page document, as we've already heard testimony about, and there's not much more there except, you know, he sort of did averagely in a class of 600, a pretty good-sized high school class.
Presumably there are records, but you didn't have access to them.
Correct.
Did you think that it was important to your diagnosis in order for you to review the various witness statements that were either taken by law enforcement or taken in depositions?
No, I mean, I did. I wanted to review the other victim in this mess, and I did. But in general, I did not think it was important because I'm talking about something that's long term, and that, you know, sadly, whether Mr. Wilson's profoundly bad behavior was occasioned by his chronic psychiatric disturbance or the use of illicit medications and drugs or both, I can't opine, but I can say that he does have the chronic psychiatric disorder.
Okay. The prosecutor asked you a minute ago, she kept talking about whether or not this was delusional or whether or not this was delusional. Did you read the statement, the transcript of the statement that Mr. Wade Wilson gave to the detectives on October 10th, 2019?
Yes.
Okay. And in that statement, he mentions having anal sex with Ms. Ruiz prior to killing her.
Yes.
Recall that?
I do.
Well, if they didn't have anal sex and he's reporting that they did, is that delusional?
It could be delusion. It could be braggadocio. I don't know. I mean, without asking him more, it's very hard to know. But it certainly would be inaccurate if it didn't occur.
How about running her over 10 to 20 times? What if that didn't occur? Is that delusional?
Again, it could be delusion, it could be braggadocio, but it is certainly inaccurate and needs to be evaluated further.
Or when he was talking to the detectives and they were asking about his feelings toward his girlfriend, when he told them that he loved her, he would never kill her, I would never even do anything. I don't know, I could never say, but I probably would kill her. And what is that?
Well, it's fascinating. B, it sounds at the least confused. And C, it's oddly self-destructive. We haven't talked about everything I think I've learned in this case, but at one point the parents describe how their younger daughter was trying to give Mr. Wilson a haircut, and she asked him to take off his shirt, and or his hoodie, and he had his shirt literally stapled to his arm. Well, why would you do that? It's obviously painful and self-destructive. I don't know the answer because I couldn't get him to really talk to me, but it suggests, significant disturbance. Most people don't stable their clothing to their body.
Okay. How about the tattoos on his face?
Well, I mean, they're disturbing and they're disfiguring, I think, but I'm an old guy. I mean, there are some people who like skin decoration, but I would say most people would be off-put by those tattoos.
All right. Did you see a picture, booking photo of Mr. Wilson?
Yes,
Okay. And he didn't have any of those tattoos on his face?
none.
I don't have any further questions. Thank you, sir.
All right.
You would agree, doctor, that telling a lie is not a delusion?
It could be a delusion, or it could be a lie, or it could be both.
Okay, thank you. No further questions.
All right.
Nothing. Thank you.
All right. You can step down, sir.
Thank you, sir.
All right. It's all right, ladies and gentlemen, it's 3:20. I'm going to take an afternoon break. Let's all go back for about 10 or 15 minutes. Be in recess. Just remember my earlier instructions.
All rise.